My philosophy of practice is comprehensive. Of course, we're moving the teeth into ideal position for the patient, both for the function of the teeth themselves and for the function of the jaw joint over time. Also, just as important are the aesthetics. And the smile, of course, is important, but also orthodontic treatment affects the facial aesthetics and the shape of the face somewhat. So we're really taking into account the whole patient when we're treatment planning for our orthodontic treatment to achieve the best ideal bite that we can, first of all, for function, and also the best aesthetics we can create. And every patient is an individual, and every patient is different. I think we run our practice on time. You'll be seen on time. You'll finish on time, as long as the cooperation is there. So we really are into convenience for the family. We understand everybody's busy, and we try to do our best to see everybody on time and to finish on time. Also, we get to know all of our patients pretty well. My patients here, I've been doing this for a while here in Fresno, and they've become my friends and almost like family, some of them. And you know, that continues on, and so I think that's a real special aspect of our practice. We don't treat people like they're in a clinic. We're not just treating their mouth. We're actually treating the whole person and becoming acquainted with them. People are realizing the benefits long term of having a good bite and a nice aesthetic result. And so I think that adult population in orthodontics in general is growing. I like to create a fairly broad smile. I feel that the facial aesthetics are much better if, when the patient smiles fully, you can see teeth from one corner of the mouth to the other. Also for patients, it gives some lip support. So as we age and we lose the elasticity in our tissues, our lips, the teeth help to hold the lip up in place. The American Association of Orthodontists recommends that we start seeing patients at 7 years of age. I realize that all the teeth are never there at that age, but there are problems that are forming that can be alleviated so that greater problems don't occur later on. Some of the new technology in orthodontics is interesting. We use wires that are so flexible you can tie them in a knot. And what that means to the patient is that we apply very light forces on the teeth. So there's a lot more comfort than there used to be. Also, we have something called self-ligating brackets. We no longer tie the wire into the bracket with a wire or a piece of rubber, but the brackets themselves have latches, which allow a little bit of play in the bracket for also comfort. So we've got really flexible wires, we've got a little bit of play in the bracket, which allows for faster movement of the teeth and also a lot more comfort for the patient. We have patients here in this office all the way from 7 years old to 80 years old. Any age person can get braces. The truth is most of us keep most of our teeth our whole lives now, and there are plenty of patients who are older who are very appreciative and get great benefit from having orthodontic treatment, whether it's Invisalign, traditional brackets, depending on the case. But there's never a right age to do it or a wrong age to do it. Any age is appropriate for orthodontic treatment.